find a little coupler. It's a little circular tube-like device. And what this is for you to be able to use two attachments at once. We wouldn't want to have two attachments in at once and, put one loop on one knee and one loop on your head. That's not what we're trying to do, or work on two different people. What this is for is this is going to create a different type of field. We have a mat underneath Jim here, and we have a loop above him, okay? And with magnetic fields, when you bring two fields together, it actually creates a stronger field than just one loop by itself. The field is called a Hemholtz field. When we create that field inside the body, the cells have tons of activity, even more so than just a single loop. So I'm going to demonstrate this on Jim. When he raises his hand, what that means, it's more sensitive when I have the loop over that area. You might see him raise his hand. That's just kind of telling me that it's much stronger in that area inside the Hemholtz field. What we're going to do is we're going to look for energy blockages that may be in his body. I'm going to show you how to plug this in first. So basically we have two inputs in the machine, but in order to plug in two loops, we have four attachments that need to go in there, four connectors. So what we're going to do is we're going to take one of each and we're going to put it into the machine. So, and it does not matter which way, as long as just one of each is into the machine, okay? Now we've got these two extras just hanging out here. This coupler is basically two female ends on each side. So basically what we're going to do is we're going to connect it to one, and again you just kind of turn it till it goes in and then turn it to the right till it clicks, just like we do with the regular connectors over here. So now we have two in the machine and two into the coupler. Now both of these are connected, okay? When we're working with a Hemholtz field, basically we have a loop that is spinning electricity, creating a north pole and a south pole, and it's flopping those poles back and forth. Now we have a mat that is spinning electricity, creating a north pole and a south pole back and forth. So when I bring those two fields together, I want the north and the south to work together, okay? So if I have one, when you're using the coupler, if I have this pointed the wrong direction, what will happen is north and north will collide and go around the body. But if I have it the proper direction, north and south will work together. And I'll explain, and Jim will be able to tell you what's stronger in just a sec. So I'm going to show you how we determine the right polarity when we're using the coupler. So I'm going to turn this on, and I'm just going to kind of hover it over his tummy. And when I turn this on, only 50% of the power is going to the mat and 50% is going to the loop. So I have to kind of turn it on kind of high. And I look for his tummy moving, and I already see it moving, okay? So what I'm going to do is I'm going to ask Jim what side feels stronger, okay? So here's this side, Jim, and I'm going to flip this over. Does that get stronger or does that get weaker? Weaker. So right now, the two fields are hitting each other. North and north are kind of colliding at each other, and it's shooting the field around him. So if I flip this over, that's stronger, right? Okay, so now I have the poles working together. So I'm still going to need it pretty high, okay, to go through the body and kind of look for these blockages. So you're comfortable right now, right? Now if I bring this towards your body, and usually what I do is I'll look for blockages, because the butterfly loop I can look in the extremities. But with this Hemholtz field, I want to check deep inside his body to see what's going on. So as I come into his hip, I want you to raise your hand if it's anything other than just muscles firing. And if it gets uncomfortable, I want you to raise your right hand for me, okay? So here I'm going to come through your body, and I'm just going to kind of hover this ring around. And right there, it's a little intense for you, correct? Okay. And that side too. So we have, so I'm here, raise your hand again if it's bothering you. There it is again, okay? So this is just for me to know where his energy blockages are. So I'm going to come this way again. He's doing okay here. sometimes under the armpits and into the shoulder. There'll be some old injuries or scar tissue. It could be some lymphatic blockages. But basically what we're going to do is we're just looking for energy blockages. We're not trying to tell people that there's something wrong with them. All we're doing is we're trying to know where we need to put these loops on their body. So I just kind of went around the sides. Now I'm going to come up the center, and he'll raise his hand if it bothers. There it is here. With Jim, I kind of know that he's got some issues around the hips. So I'm going to plan out the next 10 sessions with Jim to work on those hips until that gets fainter and fainter. And maybe next month we'll do this again and kind of see how much he's improved and how much less discomfort there is when I do that. So using a Hemholtz field is nice. After I kind of complete my little scan, I'll just set it on a spot that hurts, and then I'll just ask Jim what's comfortable. So tell me what's comfortable here. A little more, a little less. Right there?
That's good.
Good there? Now I have it plugged in. This is a different way that we can work on his hip using a Hemholtz field instead of just the loop by itself. So this is a way that we can go in and really get a lot of activity on the cells that need the attention. Some good tips with this when you have the Hemholtz field. The patient can actually hover it over themselves if they want, and they can look for areas. Sometimes they like to do that, and they like to feel where it's more sensitive, and because I don't know where it's sensitive, so sometimes I'll give them the controls and they can actually hover through their body. A good one for just kind of people who have a lot of stress, anxiety, and just kind of feeling wound up. If you put this over the head this way and you have the mat underneath them and you turn this on, 3 or 6 minutes like this, it kind of really helps calm them down a little bit. And I urge all of you guys to practice this Hemholtz field. Practice with the coupler and make sure you plug everything in and take everything out and practice with that so you're comfortable using this Hemholtz field. It's really tough to explain how it feels, but when you get it all plugged in and you try it on yourselves, you'll see what I mean, how much of a difference it is. You can use the butterfly loop with this, but if you're using the butterfly loop, you want to keep the butterfly closed, okay? Because we only want 2 fields working together. If I open up the butterfly loop, now we have 3 fields, and it doesn't work as well. So just keep the butterfly loop together. So if you have a smaller person, you can hover through with the small butterfly loop, okay? If you want to take the medium mat the smaller mat that we talked about earlier, you can couple the large mat and the medium mat on top and have a nice Hemholtz field going through with the mats. And also the giant lasso works really well. Just put the whole lasso on top. You're going to flip it over and back and find the polarity, and you're going to have a really intense field going through the body. So I urge you to try using the coupler and making every session really effective. Your patients will really think it's phenomenal when you just use single loops and then you bring them in for a session and you use the Hemholtz field. They're really going to be blown away with what they're feeling in their body. So use this as a tool. You'll kind of figure out where the patient's on fire a little bit, and you can help the doctor know what areas that they need to work on with their body also.